Hello, my name is Dr. Dewan S. Raja. Today I will discuss about cruciate ligaments injury of the knee. We'll go through the anatomy, we'll identify the anterior and posterior cruciate ligament, possible causes of anterior and posterior cruciate ligament, and the presentation of ACL tear and PCL tear, and their diagnosis and treatment. Let's go from the anatomy. The cruciate ligaments are present inside the knee joint, the anterior cruciate ligament, ACL, and the posterior cruciate ligament. This is the anterior cruciate ligament, and this is the posterior cruciate ligament. Both ligaments cross each other in a shape resembling an X. That's why they are called cruciate ligament. Okay. So these are the ligament, anterior cruciate ligament, posterior cruciate ligament. This is the lateral meniscus. This is the medial meniscus. This is the medial tibial condyle, lateral tibial condyle, medial femoral condyle, lateral femoral condyle. This is the intercondylar region. The anterior cruciate ligament, the weaker of the two cruciate ligaments, arises from a facet on the anterior intercondylar area of the tibia, just posterior to the attachment of the medial meniscus. So the ACL is not bathed by the synovial fluid. It is outside the synovial fluid. The ACL has relatively poor blood supply. ACL extends superiorly, posteriorly, and laterally to attach to a facet on the posterior part of the medial side of the lateral condyle of the femur. Functions of the ACL. ACL prevents anterior displacement of the tibia relative to the femur. The ACL prevents posterior displacement of the femur on the tibia and hyperextension of the knee joint. That is also prevented by ACL. So if we look at the MRI here, okay, we'll find out this is the posterior cruciate ligament. This is the anterior cruciate ligament here, meniscus. This is the medial meniscus. This is lateral meniscus. This is the tibial collateral ligament, fibular collateral ligament. Okay, again we are looking at the anterior cruciate ligament, and this is the posterior cruciate ligament. Anterior displacement of the tibia on the fixed femur restricted by the anterior cruciate ligament. That is restricted. Okay, like posterior displacement of the tibia on the fixed femur restricted by the posterior cruciate ligament. We now learn the actions of the ligament in a normal individual. Posterior cruciate ligament, stronger of the two cruciate ligament, the PCL arises from the posterior intercondylar area of the tibia. The PCL passes superiorly and anteriorly on the medial side of the ACL to attach to the anterior part of the lateral surface of the medial condyle of the femur. Function: the posterior cruciate ligament, it primarily prevents the backward movement of the tibia relative to the femur, contributes to knee stability, particularly in activities like walking or running on an incline, prevents anterior displacement of the femur on the tibia, prevents hyperflexion of the knee joint. Posterior cruciate ligament prevents hyperflexion of the knee joint. Injuries of the anterior cruciate ligament. Here, the anterior cruciate ligament is most frequently injured during non-contact activities when there is a sudden change in the direction of the movement, cutting or pivoting. Contact force also result in ACL injury due to sudden twisting, hyperextension, and valgus force related to the direct collision or valgus force related to the direct collision. The injury usually affects the mid portion of the ligament and it may be partial or complete, depending on the impact of the injury. Okay. ACL tear are more common in sports involving sudden stop, changes in direction, or jumping, that is, football, soccer, skiing. With an acute ACL tear, sudden click or pop can be heard and the knee becomes rapidly swollen with blood. We call it hemoarthrosis. ACL tear is always accompanied by damage to other knee structure, collateral ligament, capsule, and meniscus. Like unhappy triad. Unhappy triad includes the damage to the anterior cruciate ligament, tibial collateral ligament, and the medial meniscus. Together, lesion of all three is called unhappy triad. Okay. Sagittal MRI of knee joint showing ACL rupture. So this is the site of ACL rupture. Okay. So we got injuries to posterior cruciate ligament. Now we'll go through that. PCL injuries often caused by direct trauma to the front of the knee, such as a car accident or contact sport, or fall on the tibial tuberosity directly. PCL injury is less common than ACL injury. PCL injury require significant force, so rarely occur in isolation. Usually occurs during hyperextension of the knee as a result of direct blow to a bent knee, such as when striking the knee against the dashboard in a motor vehicle accident. Typically, injury presents as posterior displacement of the tibia. On physical examination, posterior displacement in relationship to that of the femur. Patient complains of knee pain and swelling, inability to bear weight, and instability. So these are the presentation of the lesion to the posterior cruciate ligament. Diagnosis of cruciate ligament, history and symptom is very important. Mechanism of injury, pain and swelling, physical examination, special tests like Ligament test, anterior posterior drawer test. This is easy. Anteriorly, if you pull the tibia in a flexed knee, okay, so tibia should not go too far advanced to anteriorly. In a normal person, it goes not more than normal, like the pulling the drawer and outside. So that is the anterior drawer test. Posterior drawer test, just pushing back the drawer inside. Okay, so the tibia, what happened posterior drawer test, tibia will go back, okay, more than normal, okay, and that is the posterior cruciate ligament injury, just like putting the drawer back into the place. Okay, so posterior drawer test. Another test, pivot shift test. Imaging, MRI is the definitive tool for diagnosing ligament tear. This is the gold standard, MRI. Do we need a plain X-ray? Yes. Sometimes plain X-ray may be required to find out any bony fracture around the knee joint. Arthroscopy used when necessary to directly visualize the joint. It is important. Even by arthroscopy, the orthopedic surgeon can repair the tear, may take out the excessive blood or bony chips inside the knee joint. So by arthroscopy, by the podiatrician or by the orthopedic surgeon can do it. Summary of the treatment option: we have non-surgical treatment, surgical treatment, and we should have post-surgical rehabilitation. Non-surgical treatment appropriate for partial tear, low demand individuals or those with mild symptoms include rest, physical therapy, bracing, and medications. Surgical treatment recommended for complete tears or those with significant knee instability. We need the surgical treatment. ACL and PCL reconstructions are commonly performed using graft, followed by comprehensive rehabilitation program. Post-surgical rehabilitation focuses on pain control, restoring motion, strengthening the muscle and the ligament, okay, improving the functions of the knee joint with a typical recovery time of 6 to 12 months for return to the sport. So this is a long-lasting rehabilitation. It may take 1 year to come back close to normal. Okay, and that's all about the ACL and the PCL injury, the cruciate ligaments, and its diagnosis and treatment. Idea is that anterior cruciate ligament may happen. It is not uncommon, rather it is very common condition when the leg is twisted on the semi-flexed knee, twisted outward, then usually it happens. It may be associated with damage to the tibial collateral ligament and medial meniscus. We call it unhappy triad. And that's all about the cruciate ligament injuries, its anatomy and findings, diagnosis, treatment. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.